Hey guys, today we will continue about the role of clinical pharmacists in critical cases handbook. Let's talk about the IV fluids and parenteral nutrition. So, many babies in the neonatal intensive care unit receive vital fluids and electrolytes through the intravenous tube. Some babies may need a special fluid called parenteral nutrition, where this parenteral nutrition consists of nutrients that they need until they are able to take milk feeding. The contents of IV fluids consist of calories, protein, and fats, and also it has electrolytes. This includes sodium, potassium, chloride, magnesium, and calcium. Babies need calories, protein, and fats for healthy growth and development, where it must be tailored for each baby. Not all babies can take the same amount of electrolytes or parenteral nutrition. Blood tests also help to show the baby needs of these items. The amount of each nutrient can be increased or decreased as needed. The baby's weight and urine amount is tracked daily. This also helps to assess fluid needs. So, what the common problems that include in electrolytes? Electrolytes, if it's too little or too much, it will be a big problem in babies. First, hypernatremia, which is a high amount of sodium salt in the blood. Hyperkalemia, it's a high amount of potassium in the blood, which it can be diagnosed by blood tests or it can be diagnosed by changes in the baby's heart rate pattern. Hyperglycemia, this is a high amount of glucose sugar in the blood. It's diagnosed by blood test and which we can take by often done by heel stick. Some babies may need insulin to control high glucose level. Then we have hypoglycemia. This is a low blood sugar, which is contrary of hyperglycemia, where hyperglycemia is a high amount of glucose of sugar, and this is a low blood sugar, which is always and usually treated with intravenous fluid that have dextrose, which is a type of sugar. Finally, hypocalcemia, which is a low calcium level of the blood. It's usually treated with calcium in IV fluid. Thanks.